My name is Briana Yeh, and I'm a second-year MPH student in the Environmental Health Science Department. I spent my summer practicum at the National Taiwan University Occupational Health and Industrial Hygiene Department in Taipei, Taiwan, tasked with studying air pollution impacts of a petrochemical complex in rural Yunlin County. Now, this isn't just any complex. The number 6 naphtha petrochemical complex consists of acre upon acre of thermal power plants, oil refineries, water fabrication plants, and cogeneration plants. As if the 64 plants and 381 smokestacks aren't enough, this complex also houses the Mailiao port with the capacity to handle up to 70 million tons of cargo. This monstrosity totals approximately 6,500 acres of land, but that's not all. The most distressing part is that this complex is located a few miles from nearby townships and basically down the street from a local hospital and elementary school. When I was researching this complex, my immediate concern was for the occupational health of the thousands of workers in the complex, followed by the residents in the nearby township, including the vulnerable populations of the children and elderly. In fact, these were the populations I was hoping to conduct a preliminary data assessment on. But then, reality struck. I would not be able to study these populations as I had hoped. I learned that the Formosa's Plastic Group company blocked all access to workers and health records, claiming that it was their property and they did not have to disclose this information to the public. Any efforts to get the government involved were unsuccessful. It seemed, from my understanding, that the government did not want to get involved due to the company's wealth and power. Can you imagine the amount of potential air pollutants emitted from this complex? Yet the government doesn't seem to care for this problem, affecting thousands of workers, residents, elderly, and children. I was speechless. I had to visit this area and see with my own eyes. Fortunately, NTU was able to arrange a tour for the students and faculty to visit this massive complex. This type of opportunity was unheard of. Although we were taken on a curated tour, only being able to see what they wanted us to see and hear what they wanted us to hear, never would I have anticipated this. The number of plants and smokestacks lined up next to each other, one after another, all within a single complex, seemed crazy. In addition, right outside the entrance to the complex, down a couple blocks, was a local hospital, which, by the way, I learned was owned by the company, and next to that was the elementary school. This was beyond my imagination. But seeing the proximity of how close the hospital and school are to this huge industrial complex compared to reading about it really put things into perspective. Not only are the workers exposed to air pollutants on a daily basis, but the children and sickly are as well. Then I realized the importance of all the efforts NTU and other organizations put into studying this complex and educating and protecting the health of the workers and residents. Due to this political barrier and the limited resources available in such a rural area, we had to get creative and improvise. We employed other measurement techniques to estimate the impacts. A comparison analysis was conducted between townships in high exposure zones to townships in low exposure zones to determine if there was a difference in particulate matter concentrations. Because there are only 3 air monitoring stations for the entire county, we had to use proximate techniques to estimate the air pollution concentrations. And not surprisingly, we found that the townships in high exposure zones did in fact have higher particulate matter concentrations than those in low exposure zones. Despite not being able to study the workers as I had originally planned, I still found my project very meaningful and fascinating. I was able to visit places I would have never thought of going to and see things I never even knew existed. Recognizing the power of the company and the political barriers, there is still a lot of work to be done. It is important to continue the study and to raise awareness and educate the local residents of the dangers of living so close to a huge petrochemical complex. This can potentially save thousands from the morbidity and mortality of the respiratory and cardiovascular diseases caused by industrial air pollution emissions. Thank you.